I'm Katie.
And I'm Jill, and we are occupational therapists at Therapy Playground. And we are here to discuss self-feeding as well as drinking skills in your kiddos. First, we're going to discuss, or actually Katie will discuss typical development, and then we're going to provide some general tips to facilitate feeding growth as well as increase independence and improve your child's self-feeding skills.
Okay, so let's start with feeding. Typically, children will develop finger feeding between 5 and 7 months. And then around 1 year, they will start to use a spoon. They're still pretty messy at this point. But there are 3 things we recommend when looking for a spoon, because there are so many types, shapes, brands. The 3 things we recommend are a thin handle, a short handle, and we'll talk about the depth of the spoon bowl. So the thin handle we recommend because children's hands are pretty small and that'll make it easier for them to grasp. The short handle is important, so their hand will grab it closer to the spoon bowl to give them more control. And then the depth will vary. When you first start giving your child a spoon, they might not need a very deep bowl. Some of the spoons don't even have a bowl. This is when they're just dipping their spoon into a thick puree and they don't have that scooping motion yet. Something like this will help. Then as they progress, you can make the bowl a little deeper. Something like applesauce. And then finally, when they're ready to eat foods like pastas, you can use the deepest spoon bowl. If you see that your child is having difficulty when they scoop but clear the spoon by flipping it over, this might mean they're using their tongue and the bowl of their spoon is too deep. So if you see them flipping it over before they pull it out, try just giving them a shallower spoon, and this might make that go away.
Perfect. Now we're going to talk about bowls. So if your child is having a hard time with scooping, we recommend using a bowl with a lip. This one's obviously a pretty significant lip, but we'll talk about this in a second. The lip provides a larger spot or space for the child to scoop against, so they're not scooping and basically dumping their food out. This one in particular is called a scooper bowl, as it comes with a suction that you can put onto the bottom and it sticks to the table. This prevents the child from, when they're trying to scoop, from chasing their bowl around, if that makes sense. This one is, again, called the Scooper Bowl, and it is available on Amazon, but there are also similar brands or similar items through First Years that you can find at Walmart, at Bed Bath & Beyond, and we will provide links below. So that is, not spoons, bowls. Now I'm going to talk about forks. So most toddler forks will have these small little prongs, which makes it really hard for the kiddo to stab food. So we recommend using the metal prong forks, again with that short thin handle so they have that control when they're trying to stab. And if your child is having a hard time stabbing their food, for whatever reason they can't get their fork into the food item, we recommend using a divided plate like this, as that gives the child somewhere to push the food against to help stab it. Again, you could use a divided plate like this or even an ice cube tray, as it gives that smaller space for them to stab against. And you want to, when you're starting to practice with stabbing food with a fork, we recommend using food like pasta and not slippery types of food like the fruit in a fruit cup, as that is just more challenging for the kiddo to stab.
Okay, let's talk about drinking. So your child will start to use a cup in addition to a bottle between 6 and 8 months. And then around 12 to 15 months, they should really start to transition off of that bottle and get most of their liquids from a cup. If your child is having difficulty drinking from a cup, there's something called a 360 cup. This cup won't spill, but they need to use their lips or their teeth to press down the side for the liquid to come out. You could also help teach them drinking from a cup by using a Dixie cup with just a small amount of water. Then they can learn how to just sip from the side of the cup. And then there's also straws. You can start using a straw with your child as early as 9 months. And if you're having trouble showing them how to suck the liquid up the straw, there's something called a honey bear. So with the honey bear, you can squeeze his belly and it brings the liquid up to the end of the straw. So you can show them that the liquid comes right out of the straw and you can squirt it into their mouth and increase the challenge a little, bringing the liquid down so they can suck little bits. Once they understand how to suck liquid out of this type of container, then you can just give them a regular straw. And we will provide links for all of these things below. You can check there.
So as we mentioned before, this is just a general overview of what to expect with your child's self-feeding and drinking skills. It's important to remember that all kiddos progress through these things differently. So don't worry if your child is a little bit early or is a little bit late in meeting these skills. There's clearly plenty of adaptive things, tools and tricks that we can use to help progress them through these skills. Like I said, there's some that we haven't even mentioned, something like this, which is called an easy hold for spoon use or utensil use, as well as curved spoons. So please do not hesitate to ask your therapist if you have any questions or you feel like your child can benefit from some of these tools. Thanks for watching.
Thanks.
Like and subscribe!